Good day everyone, I'm Joyce Carino from Section B. So today we're going to discuss the epistaxis, fractures of the nose, and laryngeal obstruction, and its pathophysiology. So epistaxis or nosebleed is bleeding from the nasal cavity, often caused by trauma, dryness, infections, or underlying conditions like hypertension. So the prevalence of epistaxis is very common, affecting up to 60% of the population at least once in their lifetime. The fractures of the nose or nasal fractures is a break or crack in the bones of the nose, typically due to trauma such as sports injuries or accidents. So the prevalence for nasal fractures are the most common type of facial fracture, accounting for the approximately 40% of facial injuries. So the laryngeal obstruction is a blockage in the larynx or voice box that impairs airflow caused by conditions like swelling, trauma, or foreign bodies. So the prevalence for this is less common but potentially life-threatening, often seen in cases of trauma, allergic reactions, or infections such as epiglottitis. So here's our pathophysiology. For the epistaxis, the local factors are trauma or direct injury or foreign bodies, the dry air, environmental factors, allergies, rhinitis, and infections or sinusitis or rhinitis. So these factors leads to the rupture of vessels, resulting in the bleeding from the nasal cavity. So the bleeding can be anterior or posterior. So associated with the symptoms include swelling, pain, and discomfort, often accompany the rupture. So these are the signs and symptoms of the epistaxis or nosebleed. Bleeding, swelling in nasal passages, possible in blood in the throat or post-nasal drip. And then the diagnostic exams are nasal endoscopy and the complete blood count or CBC. So may be performed to diagnose the extent and cause of the bleeding. So the nasal endoscopy is a procedure to look at the nasal and sinus passages. And then the CBC, or also known as a full blood count, is a set of medical laboratory tests that provide information about the cells in a person's blood.
So, good afternoon everyone. I'm Jordana Shin Elena from BSN3 Section D, and I'm going to discuss the pathophysiology of fractures of the nose. So, the prominent features of our faces are more than just aesthetic. It serves crucial functions from breathing, smelling, to filtering air, and protecting our delicate facial structures. But this prominent position can also make our nose vulnerable for injury, especially fractures. So, the factors that triggers the nasal fracture is direct impact such as sports or accidents from sports, falls, assaults, and also fracture from facial trauma such as car accidents. But, however, there are three forces that causes our nose to become fractured. First, we have a direct hit, or we sometimes call a direct blow, and it is a hit in front of our nose that can make the bones in our nose to bend, break, or even flatten. And second is we have a sideways blow. It is a hit at the side of our nose, and it causes the bones of our nose to shift out of place or displaced, and it can also twist or buckle the cartilage inside, making it hard to fix. And lastly, we have the force from below. Sa which is yung pag na-fracture tayo ng pailalim. Actually, it is a less common injury but still possible. And it can make our nose look crooked. And the first consequences of a forceful impact to our nose is often fracture of nasal bones or cartilage. And this fracture can be a simple break or more severe break, where bones become displaced and the impact can cause our blood vessels to rupture, leading to hematoma or subtle hematoma, which is where the collection of blood pools within the septum. So the septum is the walls of our cartilage, and the bones, it is the bone that divides the two nostrils. And hematoma can be quite painful, that can put pressure in the cartilage. And the pressure in hematoma can also cause the septum to bend or shift on one side, causing to septum deviation. And then our body will respond to injury, and it involves inflammation, or we often manifest our swelling or bruising. Swelling because the impact causes our blood vessels to leak and leading to a fluid accumulations in the tissues surrounding the fractures. Bruising or the ruptured blood vessels release blood into the surrounding tissues, causing discoloration. And it is often extend beyond our nose, and we sometimes see it as a dark circles around our eyes. And swelling and bruising will later on leads to obstruction and pain. And for the signs and symptoms, it will be discussed by Ms. Carino.
So for the fracture, signs and symptoms of fractures of the nose are nasal deformity, pain and tenderness, nasal obstruction, rhinorrhea, and or possible CSF leak. And then for the diagnostic exam, X-ray or CT scan for fracture assessment, and then endoscopy for evaluation of nasal passage and septum. So for the nursing management of fracture of the nose, apply cold compress to reduce swelling, monitor airway, assess for septal hematoma, and then elevate head to reduce swelling, and then last is refer for surgical evaluation if necessary. And then for the prognosis for the fracture of the nose, prompt treatment can reduce your risk of long-term complications like deformities of breathing difficulties.
So for the pathophysiology of laryngeal obstruction, so larynx, often called the voice box in our respiratory system, and is responsible for breathing and speaking. However, this seemingly protected area are also vulnerable for injury. So the factors that triggers include mechanical causes, and it involves physical blockage or narrowing the airway. And it includes foreign body aspiration trauma, and this occurs when a solid or semi-solid objects become lodged into our larynx or trachea, blocking the airflow. It can either be blunt or penetrating, and blunt involves a forceful impact from blunt object or surface, such as car accidents, falls, or assaults. And penetrating trauma involves sharp object piercing the skin and entering the larynx, such as stabbing or gunshot wound, leading to laceration and hematomas on airway obstruction. And also, non-mechanical causes such as croup or epiglottitis and anaphylaxis due to a swelling and inflammation rather than a physical blockage or foreign object. So, initial airway compromise or swelling of laryngeal tissues impairs airflow. Common cause of laryngeal obstruction often resulting from infection, inflammation, or allergic reactions. And this swelling involves various laryngeal tissues including epiglottis, vocal cords, and surrounding tissues. And as the swelling progresses the airway lumen, and that means the open space becomes progressively smaller, and this narrowing increases resistance to airflow, making breathing more difficult. In response to irritation or infection or anxiety, laryngeal muscles can involuntarily contract, or what we call spasm. And this spasm further reduces the airway diameter. The combination of swelling and spasm significantly reduces the airflow when the body struggles to move air in and out of the lungs. Or it decreases the airflow and resulting to hypoxia where our body doesn't get enough oxygen. And since our body doesn't get enough oxygen, the more we try to exhale more oxygen, our carbon dioxide also will build up in our blood, causing hypercapnia. And will later on leads to respiratory distress. So, for the signs and symptoms, first is stridor. It is an abnormal high-pitched whizzing sound, and dyspnea, which is the difficulty in breathing, hoarseness or voice changes, cyanosis or bluish discoloration of our skin and mucous membrane, indicating the lack of oxygen in our blood. And the diagnostic exam is laryngoscopy, and it allows for direct visualization of the larynx, enabling the identification of any abnormalities or obstruction that is present in our larynx. And CT scan of the neck, and it offers a cross-sectional image of the neck, providing a comprehensive view of the larynx, trachea, and surrounding tissues, allows for identification of soft tissues abnormalities, cartilage abnormalities, and identify foreign object that lodge into the larynx or trachea. And if it is not treated immediately, complications will lead to respiratory failure, cardiac arrest, and death if untreated. So for the nursing management, it involves maintain open airway, administer oxygen as needed, and monitor respiratory to determine if there is a stridor or cyanosis. And also prepare for emergency interventions such as intubation or tracheostomy. And lastly, reassure and calm the client. And for the medical management, for infections, antibiotics for bacterial infections, and antiviral medications for viral infections. And for inflammation, corticosteroids, either it's oral or inhaled, to reduce swelling. For allergies, it includes antihistamines and decongestants to manage allergic reactions. And for tumors, surgery, radiation therapy, or chemotherapy, depending on the stage and type of the tumor. And for the prognosis for laryngeal obstruction varies significantly based on the underlying cause. Infections generally resolve with treatment, while tumors requires individualized approaches. depending on their type and stage. And trauma can range from mild to severe, with prognosis depending on the extent of the injury and effectiveness of the treatment. So that's all for our report.